Hi, my name's Phil. I'd like to talk about politics. In this video, I'd like to discuss how, from my point of view, the last lingering threads of credibility in the government's insistence that it is following the scientific advice has completely evaporated with the news that we are being advised as a public not to wear face masks out in public. But first, if you'd like to be notified of daily news and politics, then please subscribe to the channel and click the bell notification icon. So, face masks are an effective way of spreading infections such as this. They don't guarantee that it's not going to spread, but they're a pretty good measure, one of many measures. There still seem to be a lot of people misunderstanding the role of face masks in all this. On one misconception, in the belief that it's essentially protection for the wearer. It's not that it offers no protection for the wearer, but that's not what it's for. It's essentially there to stop you infecting others. If you wanted to protect yourself, you would not just need a face mask, but you'd need full face coverage, preferably full body coverage, quite frankly, if you're really going to be proof against it. But at the very least, eyes are pretty good access for the infection, as well as just your mouth and nose. But it's beyond scientific or medical disputes that in the midst of such a panic, if you have the infection, and you may not know you have the infection, if you go out in public and you wear a face mask, you are far less likely to spread that infection to others. That is just a fact. But the UK government say that its scientific advice is against telling members of the public to wear face masks. So why is this? Is it that face masks actually, ironically, increase the chance of infection spreading, whether directly or indirectly because people feel a bit more blasé now they've got the face mask on? No, there's no evidence for that. Is it just that they don't work at all, that there's no net benefit in wearing them? No, they work well enough in terms of what they do. They prevent you spreading your salivary droplets around the air that others are going to be breathing in whenever you cough, sneeze, talk, or even just breathe yourself. Now, before I get on to loads of comments, if it's not already too late, I know that if you look at a tiny little section of the World Health Organization advice, it does say that you should only wear them if you're dealing with someone who's infected or if you yourself are infected. But the thing is that that is supposed to be part of wider advice that also involves lots of testing. Otherwise, how do you know you're infected? This is the bottom line is, do you know that you are not infected just because you are outwardly healthy? If the answer is no, then it's safer to assume that you are infected when going out in public, and hence the face mask. So, and because that is the problem. Most people who are infected, as far as the evidence can tell, are asymptomatic, which means you display no outward signs. So the government, by advising not to use face masks for members of the public, is not aligning itself with World Health Organization rules. I mean, I had to point that out because I've seen a few comments about that going on already about, face masks in public is against World Health Organization advice. No, it's not. No, it's not. It's just that you have to take all of their advice together or none at all, because you can't just pick and choose the measures. They either work together or they don't work at all. So what's the justification for advising the UK government to tell the public not to wear them? What's that all about? It's purely to ease pressure on stocks of face masks, much needed by the NHS. So the advice is, if you advise members of the public to wear face masks, got mine over there, then there won't be as many for the NHS. So it's not really scientific advice. You can argue it's medical advice, but effectively it's a political decision dressed up as scientific advice. The science absolutely says wear a face mask when out in public unless you are certain that you are not infectious. It shouldn't just be care workers and NHS staff doing this. It should be everyone that can't be certain that they are not infected, because anyone could have the infection without knowing about it unless they were being tested. This is why the virus spreads so quickly. This is why it's so dangerous, why it's scaring so many virologists, because the infected often display no symptoms. And when they do, they develop those symptoms a long time later. So you have a large period of time when you are infectious without ever knowing it and going out into the world and spreading that love. With even Germany saying that as they ease restrictions that people need to wear face masks out in public, and they have a much better testing regime than we have, but it could still be argued it's not really enough to guarantee that people are not going out infected. So you have to wonder whether or not providing the instruction in the UK, for no other reason than to preserve limited stocks, is really a scientific reason at all. And it's not like this is the first time that the government have presented a political decision as being based on scientific advice. It's just, for me, the final nail in the coffin, because at various points you thought to yourself, well, maybe they're learning, maybe they're learning, maybe they're learning. No, I think this shows that they're not learning at all. Their first supposedly scientific decision was to deliberately infect 60% of the population to develop herd immunity. This was scientifically dodgy for two reasons. One, 60% wouldn't be enough. That is just basic statistical model failing there. I said so at the time. My level of statistical knowledge is enough to know that 60% of the population isn't enough. Secondly, although the general strategy in theory is not nonsense, there was no evidence in practice to suggest that becoming infected gave you immunity. It doesn't always. With some things, yes, if you become infected with it and then you fight it off, you are then immune. For some things, that's not the case. We didn't know what was the case here. And the thing is that now that more time has passed, that evidence still isn't there. What little evidence there is suggests the opposite. Well, not the opposite. It doesn't mean you're more susceptible to infection, but it does suggest that just because you fight it off does not mean you are immune. We know of numerous cases where people have recontracted it. Next, then they said that if you develop symptoms, you should isolate. Well, okay, that's fine, that's good. But you should isolate for 7 days after the onset of the symptoms. I mean, that could mean coming out of isolation whilst you are still ill, if the illness lasts for more than 7 days. Now, without even a comparison, that sounds medically iffy advice. But there is a comparison, because the World Health Organization say to isolate for 14 days after the end of symptoms, which again straight away sounds more common sense, but more importantly is massively at odds with the so-called scientific advice that we're getting in the UK. Now, the government have been asked on a daily basis for weeks, including by shadow ministers, by the Labour front bench, on what scientific research is the UK's science contradicting the rest of the world. There has been no answer at all. Complete refusal to answer that question. Frankly, when the government's position has more twists and turns than Monaco, with international scientific advice being not only more open but more consistent, can't really believe that the government are basing their decisions on scientific consensus at all. Even now, after you think they maybe would have learnt some lessons, and maybe after Boris Johnson's little brush, maybe he'd have been a bit more sensible too, it seems not. Based on headlines in the tabloids, sure, that seems to be what they're basing their measures on, but not scientific advice. This is much more like the tail wagging the dog for me. But to look at the point just finally about the face masks in particular, because the rationale for not getting members of the public to wear the face masks is, well, it's really difficult to see if it's having a beneficial effect or not, because countries that tell their citizens to wear face masks in public also have strict social distancing. So it's difficult to tease out what beneficial effects are down to the social distancing and what down to the face masks, seeing as they go hand in hand. The problem for me is twofold with that sort of thinking. Is one, yes, on the one hand, you can say it's really difficult to say definitively how effective the face masks are. And in the face of this pandemic, the first of its kind in modern medical history, how much are we doing? What benefits are we doing by wearing the face mask? But the real way to look at it is this. Might the face masks be providing a large benefit? The answer is yes. No scientist is saying, no, we know that that's definitely not the case. That's not true. Some scientists are saying, we think it makes a big effect. Some are saying, we're not sure. That's fine. And it's one of these cases in better to have it and not need it than to need it and not have it. The fact of the matter is, if we are, as members of the public, going out, and it's not always possible to maintain 2 meters distance, particularly as restrictions start to be eased, and especially, of course, on public transport for those who are still having to use that. Would the wearing of face masks potentially help? If the answer is yes, then why wouldn't you do it? The reason why we say not to do it in this country is because we don't have enough for the NHS. But that is our fault for not having ordered more earlier on. The second side of it is it goes along with the line of thinking that, well, this is really new, this COVID-19 pandemic is really new, and it's very difficult to, research anything in this short amount of time. As if viral infections are new, as if face masks are new. They're not new. We know how effective they are in general terms as well. We know that they're not proof against infections. We know that putting a face mask on us if we are infected doesn't stop us infecting others. It just helps. And for me, that's the bottom line. It's the scientific arguments against it, when you really look down at them, are not actually scientific arguments against wearing the face masks. They're pragmatic arguments based on supply and demand. The fact is that in some countries, particularly in the UK, and as people keep pointing out, the Netherlands a little bit as well, other countries as well, the supply is less than the demand, especially if the government were to announce that if people went out in public, they'd have to wear face masks. And there are political considerations to that too. If the government were to say you can only go out, or you can, like Germany, you can only go on public transport with a face mask, the problem with that is twofold. Again, are people able to get hold of the face mask? I ordered some face masks and it took several weeks for them to arrive, so I ordered a good number of them, anticipating potential move like that. But what if you're also not able to get them quickly, but you can't afford to get them at all? What if you're amongst the poorest, already hit hardest by this, and you need to use public transport to get to work or to get to a clinic, or for any other reason, and you're not allowed because you don't have a face mask, you can't get a face mask? The government would have to source them and, with some means tested method, get them to the people who need them. And they're not even doing that for people who desperately need them in hospitals, clinics and care homes as well. So that's what it comes down to me. It really isn't a scientific argument against it. It is at best a pragmatic medical reason against it, and really when you drill down to it, it's ultimately as a result of political decisions. But those are my thoughts anyway. Let me know yours in the comments below. It can be a bit of a thorny issue, I know. I hope you found the video interesting. If you did, don't forget to click the like button, and if you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.